whenever there is a missing tooth in the distal mandible, or if there is any periapical infection, there is an immediate loss of molar and premolar teeth. So how you are going to place the implant, and which your implant you are going to place in the lower posterior mandible. So first is go for the CBCT analysis. OPG will give you only the tracking of IAN, that is a superior and inferior border from the crest you can measure, but what is the distance of this IAN from the buccal vestibule, lingual vestibule, and the perfect height from the crest to the superior border of the mandibular canal, all those things you can only analyze through CBCT. Okay, so get the CBCT done, you analyze all this length, so how it is located in the molar region. Usually the mandibular canal will be closer to the lingual corticals and rather than the buccal corticals. When you come forward to the first molar and molar, it's more towards the, that is the IAN is more towards the buccal aspect. So after that, after it reaches the second molar area, it exits through the mental foramen. So that is the stretch, how it runs. So IAN. So after measuring all the length, you have to come to a conclusion. Now how you need to place the implant. If the length is good of 15 to 20 mm, if the mandibular height and width is good, you place the implant straight. Usually the implant will be, for me, in the posterior mandible when you want to do the narrow bypass, or when you want to place it straight. So when the good length of bone is there and the width is there, I will go for the BCS 5.5 or 5 dia by 15 mm or 16 mm. You can place it straight. If the distance from the crest till the superior border of the mandibular canal is around 10 mm or 12 mm, go for the compressive implant of 4 or 4.5 dia or sometimes 3.6. So because in such cases you are going to do the lingual nerve bypass in the region of 4.5, 4.6 and also sometimes in the region of 4.4 also. So when you do the nerve bypass using the compressive, you can bend the implant. So bend the shaft neck along with the abutment to the prosthetic position. So this is the advantage of using the compressive implant in the narrow bypass technique in the lower posterior mandible. So this is usually when the height is less, you go for the lingual narrow bypass in the region of 4.4, 4.5 and 4.6. In the 4.7 region, so since in the 4.7 region, according to CBCT measurements, since the mandibular canal is close to the lingual aspect, so that is the lingual cortical plate, you can do the buccal bypass. So not the lingual bypass, buccal bypass you can do. So and you can engage the bone in the engage the implant in the corticals or sometimes in the cancellous bone only. So this is the way you engage your implants in the posterior mandibular area.